No, go back.
Choice but to freestyle.
Hi, my name is Gloria.
Hi, my name is Deborah Spencer.
Hi everybody, my name is Cody Legler.
Hi, my name is Rachel Jones.
Hi, my name is Rayvon Ferdinand.
Hello, my name is Rashard Jean.
Hi, my name is Jimbe Perry.
Hi, I'm Tanya Richards.
What inspired me is to work with the patient and to be more polite and gentle to them.
What inspired me to work in healthcare was my mom. At the age of 13, she left the Caribbean islands and traveled to England to become a nurse.
My inspiration comes from seeing how our culture comes together to serve the patients here.
Well, I feel as though representation is what inspires me as an African American, because I feel as though there's a lot of young African Americans who are currently in school right now. And I feel as though if they see another fellow African American in the health field, that'll give them the inspiration and also the motivation to achieve whatever they need to achieve, as long as they put their mind towards that goal.
The person that inspired me to work in healthcare was actually my oldest sister, Lashiwa. She was the first nurse, well, actually, she was the first nurse here in America in our family to work in healthcare.
What has inspired me as an African American to work in healthcare is the fact that I have a lot of family members who actually work in healthcare. For me, I feel like working in healthcare gives you an opportunity to give back.
I think for me it's multifaceted. Part of it is to continue a legacy that is very personal to my family. I come from a long line of nurses. And I think also it's important to me to create security and safety for people that look like me, that have to engage in our healthcare system, that may not necessarily trust it all the time.
My mom. My mom always worked at the hospital in Jamaica, and she always tells me that as long as you work and you go in with that positive attitude, it will carry you far, far away.
So one of the leaders I can give a big credit to is actually my mom. And see, she worked as a nurse, in a nursing home for well over 20 years.
I would have to say W.E.B. Du Bois. Although he was known as a writer, but he also was an activist, and he was the first person to bring awareness to the health disparities between African Americans and the rest of the world.
The African American leader that I feel as though inspired me the most would be Michelle Obama. And I say this because I believe in 2010, she started the Let's Move campaign. And I feel as though this is very important, especially now, because I feel as though children, they're very focused with electronics.
I would say it's Shirley Chisholm. For those of you who do not know, she is a politician and an activist. She was actually the first Black woman to be elected to Congress.
That's an easy one. When I was a little girl, I actually had to do a presentation on Mary Eliza Mahoney, who was the first traditionally trained African-American nurse. And I was always inspired by her story. Not only did she step into a career that didn't always welcome her, she eventually led the way for a lot of nurses that came after her. So she has definitely been someone that I've looked up to throughout my career.
An African American that inspired me to work in healthcare and continue to work in healthcare was Bernard Tyson. Bernard Tyson was the first African American CEO that I knew personally at Kaiser Permanente in California. I remember one Wednesday after all the board members had walked out of the conference room, he stayed back and he asked me, "What's your name?" And I said, "Jimbe Perry." And he told me about how he started working in the mailroom at Kaiser to now becoming the CEO. He told me, always keep going, treat people well. They'll always remember how you treated them.
Oh, I want to be remembered as faithful, as compassionate to patient, and try to do the best I can.
I'd like to be remembered as a person who came to work, who worked hard, who always went to motivate the staff, and always to create a cleaner, safer environment for everyone that came to Maimonides Hospital.
I would like to be remembered for my kindness and my patience, and also how comfortable I make patients feel.
I would like to be remembered as a fair person, someone who is compassionate and understanding, because we all need that person.
I think for me, especially in a position of leadership, it's to lead with integrity and compassion, and to open doors for people who may not think that there's a door for them to even walk through. So really to leave a legacy that they can do this too.
How I treat people, my work ethic, all that encompassed in one is how I want to be remembered in healthcare.
I would like to be remembered as someone who led with empathy, someone who really listened and listened deeply, someone who was seen as a problem solver. I think when it comes to healthcare, there are a lot of circumstances and challenges, especially what we've experienced within the last few years, being in Brooklyn and working at Maimonides. And for me, I want to ensure that when someone encounters me, that they have a positive experience and that they always remember how I made them feel, which obviously is in a positive light, as opposed to not just things that I've said, because usually there are actions behind my words as well.